Hello everybody, it's Roselle Leacock of Mrs. L's Learn and Spell channel. Thank you for being with us today. So you've been looking for the perfect card game that teaches children about common infectious diseases and how it affects their bodies and how they can prevent them. I have the perfect game for you. It's called Dr. Fix-It. Dr. Fix-It is designed for children ages 3 to 5 and to be played with an adult. It comprises 24 cards in the deck, including 3 disease cards, 3 symptom cards, 2 treatment cards, and 2 prevention cards. So let's introduce the cards. First, we have the common cold. Each card is color-coded. So we have blue representing the common cold. So that's the disease. We'll also explain what disease means to the child so that they understand. We have a picture exemplifying, and we have a simple description. A cold is when tiny germs hurt your nose and throat, making you sick. And we will highlight the symptom. We'll also explain what symptom means. And the first symptom is a runny nose. We'll explain to the child that when you're sick, you can have a runny nose when you're sick with the common cold. Also, sore throat and coughing. Then we discuss what treatment means with the child. So we have medicine, and if we have the medicine at home in our cabinets, it would be ideal to reinforce. We also have lots of rest. So we explain the importance of rest in healing the body when sick. And we have preventions. We'll also explain what preventions are in a simple way. Wash your hands a lot. So with soap and water, we explain that it's important to get the germs off of our hands. And also to keep our hands off from our face. Do not touch your face. So we express the importance of that so that the germs don't get into our bodies. Next disease is in red. We have hand, foot, and mouth disease. We have a picture there of a child with the disease. A germ you get from touching someone or their waste. So we'll also explain what waste is here in terms of fecal matter and how coming into contact with it can give the child this disease. We have the first symptom being sores in the mouth. We have a fever. So the child may run a temperature. There's a rash on the hands, the feet, and the mouth. So the rash can be on the outside, and we can have ulcers and so on the inside as well. We have treatments. Use rash lotion. So we can explain that there's calamine lotion. We can mention the name if we wish, or we can just mention that there's a special lotion that we use to help with the itching and the rash. Also treatment, drink a lot of water, the importance of hydration in the body healing to get better. Prevention, so we clean up a surface or a table or whatever we may touch that others may have touched so that we don't get the disease. Do not rub your eyes. So we explain how the germs may be on the hand and can be transferred into the body. Lastly, we have air infection. When germs get into the air and causes it to hurt. So we have the symptom, the liquid or the infection may leak out of the air. So we can explain that to the child that we may see some yellow fluid there at the exit of the air. We have symptom, crying a lot. So the child may be irritated and fussy because of the pain that they feel. And also we have air pain. So the child may rub or tug the air due to the pain that they feel. Treatment, air cleaning. So you explain to the child that they could go to the doctor to have the air cleaned or flushed out. from the infection. Medicine such as antibiotics or painkillers may be used to rid the infection. And preventions, if we must swim, we could swim with air plugs to keep the water from getting inside and causing the infection. And lastly, do not put things into your ears. So you explain the importance of not putting things in the air to irritate the air or hurt the air and cause the infection. Stay tuned to how we actually use these fun cards to play the game. Welcome back to our Dr. Fix-It game. As we mentioned before, multiple players can play, but we recommend 2 to 4 players. So to begin, we start with laying out each disease card about 3 card spaces apart. Next, we allot about 3 card spaces down from each card for the 3 rows: symptom, row 1, treatment, row 2, and prevention, row 3. After this, we begin to shuffle the cards. After shuffling, we lay them out at the bottom of the other card. Before beginning, we'll explain to the child what each disease is. So we explain what disease means, and we explain each disease. Common cold. Cold is when tiny germs hurt your nose and throat, making you sick. Hand, foot, and mouth disease. A germ you get from touching someone or their waist. Air infection, when germs get into the ears and it hurts. A further explanation may be given if needed. Now, the first player draws a card. First card says symptom, rash on hands, feet, and mouth. So we'll explain to the child that when you have hand, foot, and mouth disease, you may get rash on your hands, feet, and your mouth. So this is a symptom card, so it will be placed directly under the hand, foot, and mouth disease card in row 1 as it is a symptom. The next player, going in a counterclockwise manner, will select a card. Next symptom card was selected, we'll place it on the ear infection as it corresponds. Next symptom card, runny nose for common cold. Symptom card for ear infection, crying a lot. Prevention, swim with air plugs. So that will be placed at the very bottom of the ear infection disease. Prevention, so this will go at the bottom of the hand, foot, and mouth disease pile. So players would keep playing and placing cards accordingly. Symptom, so it's in the mouth. Prevention, so go here at the bottom. Treatment, rest, will go here in the second row. Prevention will go here at the bottom. Symptom, coughing will go here. You have symptom again, which will go here. Treatments. Treatments again. Symptom. So seeing that this disease is completed, the last person to place the card will shout, "I'm Dr. Fix-It," and will be declared the winner. Thank you for playing. I hope you enjoyed it. I know your little ones will. Go grab yours today. Please like and subscribe.